Thank you so much for joining us today. I'm here with Jerome Lothridge, our Secretary of Health, Dr. Casey Schramm, our Secretary of Science and Technology, Tim Pearson, the President and CEO of Integris, and Sean Bauman, the President and CEO of ME Labs. Thank you for joining me today. I want to give you an update on how we're doing with our fight against COVID-19. We're here at Integris Baptist Hospital and on Portland Avenue here in Oklahoma City because this is the site behind me that plays a key role in our hospital surge capacity plans. If you remember, we talked last week about our comprehensive hospital plan. Oklahoma, we are still in great shape when it comes to hospital beds, ventilators, and ICU beds. We currently have 325 people in the hospital across the state of Oklahoma. That number peaked at 560 back on March 30th. And for the last 2.5 weeks, we have continued to trend down. However, I want you to know that we are still preparing for a surge. We do not expect this to happen, but we are staying proactive just in case it does. If we need additional capacity, Integris Baptist Medical Center, Portland Avenue, has stepped up to be our COVID flex location here in Oklahoma City. This will go along with the OSU Medical Center in Tulsa. We are so grateful to our hospital community for partnering with us to provide Oklahomans the care that they need. I'd like to invite Tim Pearson, the President and CEO of Integris, to give us an update and to say a few words. Tim?
Thank you, Governor, and good morning. As was mentioned, I'm Tim Pearson, the President and CEO of Integris Health. As Governor Stitt shared, Integris is pleased to have the opportunity to partner with the state during this time of crisis. We are here today to announce the state's Level 2 surge facility, one of them. The Tulsa one was announced earlier, and today the second one will be here, operated by the state. Last week, the state officials contacted me after they heard that we were consolidating patients from this Portland campus here at Baptist Medical Center to our Baptist Medical Center Northwest campus, and wondered if they could use some of the beds that we do not use. We, of course, were happy to do what we could do to help. We're very engaged with the governor and his team on the Level 1 surge plan. And because the Baptist Avenue Portland campus is such an important part of what we're doing at the Baptist Medical Complex, we said that there's a way for us to use these beds that aren't being used to help the state. So, as mentioned, 110 beds at this campus, the Baptist Portland Avenue campus, will serve as Oklahoma's Level 2 surge facility. This partial bed lease will be accomplished without disruption to normal operations at our Baptist Portland campus here. Safety is our #1 priority, and patients who seek COVID care, non-COVID care here will be able to receive the safe care that they've always been able to receive. If we do continue to see a surge, then once the 140% capacity at each of the hospitals comes into place, this hospital will be activated. And as I said earlier, we're very pleased to work with the governor and his team. I will mention Secretary Lothridge has been instrumental and is working tirelessly as a wonderful public servant to help make these things happen. We're grateful to participate with the state in serving the community needs. It's very consistent with Integris Health's not-for-profit mission to serve people in the ways that they need to get their care. So thank you very much, Governor. We're pleased to participate.
Thank you so much, Tim, and thank you to Integris for partnering with the state of Oklahoma. You are doing a tremendous job. I had a call with President Trump yesterday, and we talked about the White House guidelines to get our country safely reopened. And let me be clear, I know how badly many of you want to get back to normal, get back to a normal way of life. We will continue to make decisions based on the scientific data and the information that is happening on the ground here in the state of Oklahoma. We'll also make decisions based on the advice from our health professionals. Our cases are trending down and our curve is flattening. That is great news. Two of the main keys to getting Oklahoma back open are enhanced testing and contact tracing. Last Friday, we were in Tulsa and heard that some of the Tulsans could not get tested or were having a hard time getting COVID tested. I'm here to tell you we have the testing capacity in the state to test anyone with symptoms. That's why we are standing up 2 more mobile testing sites in Tulsa. One's going to be located at the OSU Medical Center, Health Science Center, and one is at the OU Center for Health. Those will start on Monday. Those sites will be open to anyone showing symptoms of COVID-19 or who have been exposed to anyone who tested positive for COVID-19. You will not need an insurance or a doctor's referrals to get tested at those sites, but you may want to call 211 just to find out more information and their exact locations. We're also making great progress on antibody testing. That's a test that shows if you've been exposed and you have started to develop antibodies, and even if you didn't have symptoms, it's going to show that you've been exposed. So I've got Emmy Labs in Norman has been a great partner with the state of Oklahoma, and I've asked Sean Bauman, who's the CEO and president of Emmys, to give us an update on the antibody testing. Sean, can you come up and give us an update?
Thanks. Yeah, I've had the great privilege to work with the Governor Stitt's team on developing this new test for new blood test for antibodies that tells people if they've had an exposure to this COVID-19. So we're excited to be able to offer this testing service to Oklahomans. Oklahomans is our priority. We provide the testing service, but we also are setting up partnerships all across the state to expand access to this critical testing need. So my team has been actively involved. We've had lots of partners to be able to make this happen in a very, very short period of time. This test, I think, is going to be really important to help us understand where Oklahoma is in the epidemic. Oklahoma is in a unique position because no other state, to my knowledge, has had both of these tools at their disposal as they head towards the peak of the epidemic. So it's been a great privilege to work with Governor Stitt and his team and the folks at the Oklahoma Department of Health. Thank you.
Thank you, Sean. We're so proud of you. What a great company and entrepreneur here in Oklahoma that's stepping up to help curb this and give us more data as we all get back to work. So we really appreciate what you're doing. You know, antibody testing is really going to play an important role to give us data, to give our modelers data, to get Oklahomans back to a more normal way of life. I'd also like Dr. Casey Schramm, she's our Secretary of Science and Innovation, to explain a little more about what we're doing across the state. So, Dr. Schramm, can you give us an update, please?
Thank you, Governor Stitt. Oklahoma continues to make strides in our testing and reporting. Antibody testing is a component of our testing capabilities, and as I said earlier this week, we worked closely with Emmy to develop those capabilities. Antibody testing determines that an individual has come in contact with the virus and mounted an immune response. The test does not determine immunity, but it may indicate decreased risk. The test is not intended to be a diagnostic tool, but it is very helpful to us as we look at the prevalence of infection within the population. The Oklahoma State Department of Health, in partnership with the Oklahoma Blood Institute and Emmy, completed its first surveillance test of approximately 1,000 Oklahomans. Samples were received between April 2nd and the 9th from 21 cities across 17 counties in our state. The presence of antibodies of COVID-19 was 1.4%, which would suggest that during that time period, there was not a wide spread of infection of COVID-19 in Oklahoma. That means we're doing a good job with our social distancing. We will continue to utilize the antibody testing as a surveillance tool in looking at the general population and in special populations in our state, such as long-term care facilities, as well as essential businesses that, if an outbreak occurred there, could create hardships for the overall population, as well as in our healthcare workers. As of 4/16, we have tested 33,545 individuals through PCR testing, which is the nasal swab testing, with 7% testing positive. Soon, OSU Lab will be validating the use of saliva for PCR testing in the near future. We're very fortunate to have a world-class laboratory such as Emmy that manufactures and distributes innovative lines of diagnostic tests and reagents for infectious disease right here in Oklahoma. We ask that you all continue to be patient. We appreciate your patience to this point, but be diligent in your social distancing, practice good hand hygiene, and wear masks in public as recommended by the CDC. Thank you, Governor.
Thank you, Dr. Schramm. We're also starting to be laser focused on our nursing homes and our long-term care facilities. That's where a third of the deaths, of the 136 deaths in Oklahoma, have come from. We know our elderly Oklahomans and people with underlying health conditions are at a greater risk, and we will continue to protect them even as we allow our healthy Oklahomans to begin the process of returning to work. I've authorized the National Guard with teams from the State Department of Health to be able to quickly respond to any nursing home outbreaks. We've called up some medics and decontamination experts who will work to clean those facilities and train their workers if needed. I'd like to have Secretary of Health Jerome Lothridge give us an update as well on what we're doing with contact tracing.
Thank you, Governor. There are really two components that we're taking into account as we prepare to think about how we get Oklahomans back to work. One of them we've already referenced through Dr. Schramm and through Sean Bauman, and that is testing. And so testing both with respect to PCR and antibody testing. The second key component is contact tracing. And as the name might imply, that is the process by which individuals who have tested positive are contacted and then are walked through the last several weeks of their individual personal contacts to help us determine where it is that the virus may have been spread. This is an important part both from a public health standpoint and as we think again about putting people back into the workplace. This work, which we refer to as really the shoe leather epidemiology, this work is carried out in a couple of ways. The State Department of Health, both through its epidemiologists and through others who have been brought on board, including nursing staff, conduct such contact testing and tracing as we speak. But today we announced that we are also pulling in medical students at both of our state's facilities, Oklahoma State University and the University of Oklahoma, medical students who will be able to help in the process of contact tracing. I think this is evidence that Oklahoma continues to innovate as we confront this COVID crisis.
Thank you, Secretary Lothridge. I want to stress that the White House guidelines for reopening focus on testing and tracing. In Oklahoma, we are committed to doing the exact same thing here. The President said yesterday that this strategy is based on hard, verifiable data. We have been making decisions in Oklahoma based on scientific data and what we're seeing on the ground here, not what we're seeing in other cities and on the news. We're working with the health department on guidance for businesses to get open safely. If our positive trends continue, we hope to share more details next week about how to roll that out. I also talked with Dr. Fauci yesterday, who you've probably seen on TV. He stressed that the White House guidelines are a very measured response. He stressed governors need to act on the data they're seeing in their respective states. The president called on Americans to do their part as we continue to fight this virus, and I'm asking you, Oklahomans, to continue to do the same. Continue to wash your hands frequently, telework where you can, stay at home if you're sick, and maintain social distancing in public. I am committed to protecting our most vulnerable population, but I'm also committed to protecting the hardworking Oklahomans who are struggling right now to pay their bills and they're ready to get back to work. There is light at the end of the tunnel, and we are going to get through this. So God bless you, Oklahoma. Thank you so much, and we'll open it up to a few questions now.
Governor, you talked about the White House guidelines and communications with the White House. I know you said you may talk about possible rolling out. You talked about possible rolling out of new information next week. The president alluded yesterday to some states, maybe they'd even be ready before March or May 1st. Do you see any scenario under which you would lift any of the more serious restrictions before May 1st?
Well, we lifted, I signed an executive order, I believe it was yesterday, on elective surgeries. So we gave some guidance there to slowly start rolling out the elective surgeries. I think it was 9 days away, so on April 24th. We're getting guidance from some retail, some of the churches, the Restaurant Association. We're combining that with a phase 1, phase 2, phase 3 approach. So I don't anticipate anything before May 1st. But we are continuing. We're going to make this based on data and what we're seeing. If these trend lines continue the way they have been, then we believe that May 1st will be a good time to start proactively reopening some things up. Also, the business community are doing a really good job. Most of them are working from home. They will start slowly bringing employees back in a very thoughtful manner, and we'll continue to do testing. And that's why this antibody testing, we're so proud of the Oklahomans that are stepping up to get us some more tracing in the testing across the state.
Governor, right over here, Governor. You talked about doing elective surgeries, making those open again, but yesterday the Oklahoma Hospital Association came out against that, saying it's too soon and could be putting caretakers and patients at risk. I guess, what are you guys seeing that they don't see?
Well, we have 325 people across the state in our hospitals. We're also, the reason we suspended elective surgeries in the first place was to protect for hospital beds, to make sure that the surge didn't happen, we didn't get overrun, and also to protect PPE. Today we have 13 days of PPE at our hospitals across the state. We have our strategic supply. We feel really good about it. Obviously we can back up and change our minds if any of those things change. But right now we're doing this, it's the right time to open up elective surgeries. And a lot of our rural hospitals need that. That's how they pay their bills. And I was afraid we'd have other issues that would come up if we had hospitals that were closing down.
Governor, in regard to that, they're also worried about patients coming in and having been tested for COVID-19. They could have nurses could be exposed to people that they have no idea whether they've got the disease.
A hospital being concerned about somebody coming in through their doors that's COVID, they're going to take precautions. They have the protective equipment in their respective hospitals. So to me, it's not a reason not to start opening up the elective surgeries.
Governor, we have a pretty high case mortality rate here in Oklahoma, 5.6%. Our latest numbers, 4.9% nationally. So that's about close to a percentage. So I have two pretty important questions on that. We're talking about opening up Oklahoma again. Of course, we all want that. If we do that, though, even starting it with our plans, are you concerned that, we're going to have a spike again? If we do, what's your plan for that?
Well, I'm going to let one of the experts talk about the death rates here in Oklahoma. We obviously are preparing for if there is a spike. That's why we're continuing with our surge plans. That's why we're continuing with our hospital plans around the state. The fact of the matter is we have 10 times the capacity of ventilators that we need on what the modelers are saying that the surge would be. We also have 4 times the hospital beds needed. That's what I want Oklahomans to know. We are making these decisions based on data in our state and what the capacity we have. We're not going to put Oklahomans in jeopardy as we slowly start reopening the economy. And I'll let the experts talk about the other thing.
Yeah, so if you look at the percentage in the population, the death rate, as the governor alluded to previously, 40%, roughly 40% are around through the long-term care facilities. And so that is a strategy that the governor talked about. We're putting a lot of effort into focusing on containing, tracing, testing. Those are all foundational in order to open up and begin to move about so that we can continue to monitor. And so even through the president's guidelines for reopening, testing and tracing are important. So we are putting efforts towards controlling it and monitoring, containing the spread throughout our long-term care facilities, as well as putting things in place that will allow us to track, trace. So if someone tests positive in the community, we can begin to isolate and quickly contain that so it doesn't continue to spread. But it also, the testing capability allows us to monitor that on an ongoing basis.
I guess that was kind of part of my other question going into the mortality rates. So he mentioned that 1/3 of our deaths in Oklahoma were coming from these long-term health care facilities and stuff. I know we have several even in the Tulsa area who have had outbreaks. And we were talking about the National Guard responding to those at this point and doing that. But what about proactive things? Are we looking to go ahead and go to all of our facilities and test them ahead of time? Because I feel like when an outbreak happens, it's probably too late, or not too late, but...
Yeah, absolutely. So that is what we're focusing on, putting together a plan to address not only what's occurring now, but looking to the future. And I believe next week you'll be hearing more about the plan that we're rolling out. But we have put together a task force to specifically address that.
So I have a question for you. The chart that's been used to show the flattening of the curve there, we've had several readers, ask us about the source of that data. There's not any sources listed with that chart typically. What are the sources? Are those studies that your department has directly done?
The IHME data is the curve that we're looking at. We're also looking at our data. So data here in the state is being looked at by the epidemiologist at OU, OSU, and the state health department. But the curves, we're also looking at the IHME model, which is what was recommended to us by President Trump.
Governor, can you elaborate a little bit more on how you're going to decide which non-essential businesses will reopen back up?
Well, that's all in the planning stages right now, and we've obviously have the restaurants working up a plan. We've got the state health department working up a plan. We have the guidance that we're reviewing from the White House is phase 1, phase 2, phase 3 plan. And so next week, if the trend lines continue, then we'll be giving more guidance to some of those businesses next week.
Governor, earlier this week you had a call with Education Secretary DeVos about some emergency education funds that you'll be able to spend here in Oklahoma. Can you talk about what your plan is, how to disperse those funds, and what issues you're looking at related to that?
Sure. So it'll be close to $40 million that is given to the benefit of education. And Secretary DeVos told me on the phone that number one, focus on the kids, focus on them. Number two, the educators. Number three, the actual system. So we're looking at a lot of different things. We're looking at AP programs around the state to some of the rural communities that may not have access to it. We're looking at equal opportunity scholarship funds to be able to backfill some of those. So just got a lot of things on the table, and we'll be in concert with the education community to figure out how to get those best on target to help the kids in the state of Oklahoma.
Governor, you had a conference call with churches today talking about, I believe, wanting to have them open by the 3rd. Is that kind of a realistic date, especially when earlier this week you had a note from the Conference of Churches about how they think it's still too soon to start those gatherings?
You know, we had a great call with the church groups. I have calls all week long with the different organizations around the state. And so I encourage them to set up their guidelines, their guidance on how they want to safely reopen. And again, we're going to monitor the data, and we're going to come up with a great plan that protects public health, protects safety, and then starts to ease back into a more normal way of life as we're watching the scientific data roll in here in the state of Oklahoma.
Governor, the Board of Equalization set a meeting for set a meeting for Monday. What exactly will be on the agenda? Do you have? It will be the exact same revenue shortfall we were expecting. And then I have one for Secretary Schrum.
Yes, so we set the meeting for Monday, and it'll be. I think there's a couple of agenda items on the meeting. One of them is to address the revenue shortfall for 2020, the last couple months of this fiscal year.
That 450 number.
I haven't seen the exact number that'll be a revenue shortfall yet, but it's somewhere around that number.
And Madam Secretary, can I ask you a question about the antibody testing? You said about 1,000 people were tested. I've seen studies in other places talking about a lower level of antibodies than you might expect for other viruses. Did you see that? And then what's the plan in the future for that type of testing? Will it be something that people call up and say, I want to get tested, or how would that work?
Right. So we do anticipate that that'll be rolled out more broadly across the state for people to utilize through their physicians' offices and other places. So as far as, we weren't quantifying or looking at the amount of antibody, just the presence of antibody in that test. We anticipate continuing to, look across the state with our epidemiologists to roll out what's the population need to look like, sample size, and all of those things that give us the data that we need in order to continue to do surveillance on the population so that we get an idea of how many people are exposed to the virus across the state. Again, in the general population as well as in those special populations that I referred to earlier.
Governor, can you talk to just real quickly about, everybody wants to go back to normal, but how that's just going to take time and people need to have patience with this and still practice all of those good hygiene and social distancing even when we do start?
Absolutely. That, very well said. This is going to be a phased-in approach. As we continue to monitor this data, we're going to have a plan for a surge in the fall. We're not going to stop our planning on our surge capability in the state of Oklahoma. We're not going to stop our tracing, which is going to be very critical in isolating and finding out where any future outbreaks may be. But the restaurants that are working up their plans, it'll look a little different at first. We're going to have tables spaced out, et cetera, and then we'll continue to monitor, and it'll just kind of over time get back to normal. So I can't give you an exact timeline, but we will start stepping back into a more normal way of life. Most of my sometime in the month of May and early May, hopefully. Most of my executive orders expire on April 30th. We're looking at all of them. We've already extended our safer at home order for the most vulnerable population through May 6th. And we'll continue to monitor those as the data comes in. So this is not a time to take our foot off the gas. We need to continue with the social distancing. Oklahomans, for the most part, have done a really, really good job, and I want to commend them. I want to commend the business community. I want to commend the grocery stores, the pharmacies, the deep cleaning that they're doing, opening up their stores early for the most vulnerable to do their grocery shopping. So Oklahomans have done a great job, and we're seeing this in our data. And if you remember, a couple weeks ago, I told Oklahomans the better we do over the next 3 weeks is really going to determine when we can get our life back to normal. And so we're doing a good job. Hang in there a little bit longer. We've got to continue to watch these curves flatten out, and we're going to get there. But we will start slowly stepping back in early May.
Governor, I have a couple clarification questions about the church thing. Going back to the church question, can you just clarify you are having talks with church groups about trying to open up May 3rd, or what? Just clarify that for me.
Yeah, sure. So, well, first off, the state, it's outside of the state's purview to shut down churches. And so that's been very clear. These are all guidances. The churches, for the most part, have all adhered to them. We've been doing church online for the last few weeks. And so my call with the churches today was to tell them, hey, come up with a one-page set of guidelines. I've asked the health department to do the same thing. We'll cross those. We'll make sure that we have a standard set of guidelines across the state. When we feel like it's appropriate to roll those out, we'll do that. And my hope would be on the May 3rd Sunday to allow people to start easing back into this. But there's a lot of things to think about as we social distance, as we continue to the nursery workers and those kind of things. And those are the things that the churches are working through to keep us safe.
And with the National Guard and the nursing homes, with the places we've already had outbreaks, are you sending the National Guard out to them right now for the things that you were talking about that you're planning to do with any future outbreaks?
Yeah, so I authorized the National Guard to go do a deep cleaning in all the different nursing homes. And we also have some TAC teams that we rolled out to the different nursing homes. To your point earlier, we want to be proactive and we want to start doing testing in those homes that do not have an outbreak, because that's where a third of our deaths have come from, is out of nursing homes. So I really want to do a deep clean. I want to do testing there. We've already set up plans. I've been working with the Nursing Home Association to set up some, flex units to move some COVID patients so we don't continue to spread it inside. They're already in lockdowns in their different places. So we're doing everything we can, but I'm pushing the team to continue to do more with our long-term healthcare facilities.
And a follow-up with that question, besides the nursing homes with the National Guard, can you talk about other duties that they have since they were deployed yesterday?
So, the National Guard, I think we're up to 226 soldiers right now that are deployed. We have them stationed throughout the state at the different hospitals to make sure that the data coming in is good with us. We have them in the nursing homes doing a deep clean there across the state. And we've also have them distributing PPE supply throughout the state. We have 6 different warehouses around the state that our strategic national stockpile ships to, and then we have our National Guard there helping with that as well. We also have National Guard working at the 80 different testing sites, mobile testing sites across the state, to make sure that they're handling the traffic flow, they're handling the testing, and so that's basically where we have them.
Governor, along the lines of the National Guard, Governor, one of the city council members of Oklahoma City sent you a letter requesting that you consider sending the National Guard to do similar help to the homeless shelters in the urban areas. Homeless are very social. They live very close together, do a lot of interacting. There's a deep concern about COVID-19 spreading through that population. What do you think at this point about having the National Guard help the homeless shelters in the same way that you're having them help the nursing homes?
Well, it's certainly a possibility. You know, the John 3:16 missions, the missions around the state, we're very concerned about the homeless population. They're working there to keep them safe. And it's not a mission that I've approved yet for the National Guard. I want to be very judicious in how we get them deployed, because we are pulling them away from their jobs in some cases in the private sector. So, but our number one priority from the very beginning was to protect the health and lives of Oklahomans. And the number 2 is to protect the economy, get our folks working back as quickly as we can. And so those are all things that we're considering to do with the homeless population.
Thank you, everybody. Thank you.